This is lesson number 1 in the program for therapeutics for changing what's going on with tongue posture, lip posture, head, neck, and body posture as well. Lesson number 1 in the oral myology program begins with wearing what I call a spot. A spot is designed to guide the tongue to begin to rest on the roof of the mouth. These are the upper teeth. I have found spots to be the most valuable part of this entire therapy. After the spot is in for lesson number 1, you're going to do 20 tip pops, done with the tip of the tongue at the spot. Suction slightly into it with a nice firm pop done by the tip of the tongue, no other part of the tongue. You're using the styloglossus muscle and also the muscles of the neck, and that means certainly the hyoid, so all of the hyoid muscles, to get the pressure upward into the palate to create a suction to create the pop. The second therapeutic exercise is called taco blows, and it's designed to cause the lateral borders of the tongue to elevate, the center of the tongue to drop, and the tip of the tongue to lift, so that you blow forward and suck inward with your tongue extended through your lips to actually make your tongue into a taco. You must blow with some gusto in order to get the muscles to work properly. Like that. Most people can do this, but many who think they cannot need a little boost by using a pen, a mirror, the tail of a mirror, or a pen or pencil to set down the center of that tongue. And the key for really creating this to happen well is that the person learns how to pucker their lips. Those are done 20 as well. If you're having difficulty with a patient learning how to do a taco blow, and they've learned that it's genetic, which I don't believe, what you do is train them by pressing the end of a pen or a popsicle stick or something that's round or flat and not very wide down the center of their tongue, and have them wrap their tongue around it. But the key to this is the pucker, so that the lips actually hold the lateral borders of the tongue up. That's a relatively easy exercise after someone believes they can do it. You see how many muscles that actually uses by just doing that one exercise. We're working suprahyoids, we're working the lateral muscles in the face, and certainly the lateral borders in the tip of the tongue. For the lips, what we're doing to begin will be something that most people can do. You roll your lips in over your teeth, press them together, and pop them loudly apart. These are called lip pops. You might get an occasional person who goes. And the easy way to teach that is to ask them to do a small kiss and then turn that kiss inside and pop. The muscles of the orbicularis obviously used a stretch of the levator muscles on either side of the nose as well. And a nice stretch of the philtrum is what we're going for, which is typical that on the second session, when these patients return, you should see quite a change in upper and lower lip length just from doing these two lip exercises. The second of which is called Great Granny or Grandpa Surprise Face. It looks like this. It's an elevation of all of the anterior face muscles, but a nice stretch of the orbicular muscles to stretch the distance between the banded muscles to increase the lip length there. And in doing that, what we get is a shortening of the lower lip. Typically, many people have this kind of protrusive lower lip when they start, and a short upper lip with a very tight mentalis muscle. As you elongate the upper lip, certainly the philtrum, as it becomes longer, you get a relaxation in the mentalis muscle and the development of a nice chin. The last exercise on lesson number 1 is a posture exercise where you ask your patient to stand straight with arms elevated against a wall so that they're beginning to expand their pec muscles and the shoulders so that they're not leaning forward. Those of us who are in helping professions tend to wind up leaning forward into our patients, certainly dentists and dental nurses, dental hygienists, speech pathologists are doing this kind of thing all day. So it's helpful if we can get them to stand straight. Wall stand looks just like this. You want the arms at 90-degree angles as much as possible, the head touching the wall, the tailbone touching, and the heels as well. This is 30 seconds of just standing like this in order to begin to stretch out so that these people begin to lift the rib cage, and this is the beginning of some better breathing for most of your patients. For lesson number 2, you're going to continue using spots. So the tongue is still needing training to be right there where it should be at rest, both morning after breakfast, afternoon, sometime after school for the school kids, and at night as the patient goes to bed. One of the first things you do on the second session is to review what's gone on the first session. If they're unable to do the taco blow, you might have them instead do tip sit-ups so that you're beginning to get the tongue at least lifting. A lot of people have a difficult time doing that without touching their upper lip, but we're assuming that they're able to do that. So the first exercise is going to use that taco blow by pressing a stick down the center of the tongue and holding it horizontally for 20 counts. One of the things that I like to do is have people add more weight to this. We're using American pennies here. You can use any kind of coin. And if you notice, it's about a third of the way back on this stick. If you can get lolly sticks or popsicle sticks, they're called in the US, then they're quite simple to hold down the center of the tongue in a horizontal plane, so that you are actually building the lateral border and the tip muscles of the tongue. The second exercise is called palate scrapes, designed to stretch the frenulum, especially post-frenectomy or post-frenectomy, depending on what it's called. If you sent your patient out after the first visit to have a frenectomy or a frenectomy, hopefully they've done some other exercises, but what you want to get is some stretching of the lingual frenulum. You open wide, and they're called palate scrapes. Moving the tongue tip from the spot toward the soft palate. If the lingual frenulum is quite short, it's going to be more difficult. This may be another impetus for you to be able to send them to have a frenectomy if they cannot do this. You do 20 of these. So they're getting a nice stretch. Works the hyoid muscles as well. The button pull is designed to strengthen your orbicular muscles and help also to lengthen the upper lip. We want the lips to be closed tightly around the button with the molars touching as much as possible. So you keep teeth closed. It's very tempting for the patient to move that lower jaw forward. Notice how much the lateral facial muscles play into the button pull. That one's done 20 counts forward and on each side. Straw drinking is done by closing the back teeth, occluding on the molars if possible. If they don't have molars, they need to close as much as they can. But the key on this one is to pucker. If you try this when you close your teeth and pucker, your tongue just naturally elevates to the spot. There is no way, as they drink this way, that they can be going if their teeth are closed. The last exercise on list number 2 is a posture exercise where it's called wall slide. This is called wall slide. The patient is going to assume the position as they did in lesson number 1 for wall stand. Feet touching the wall, hands and arms, forearms touching the wall as much as possible. Then they're going to bend the knees slightly, focus on tightening the thoracic muscles and pulling the back against the wall and sliding up and down. And they don't have to go far. I'd rather that they didn't lift the feet off the floor, if possible, the heels off the floor. So you're getting a really solid stretch just up and down. For some people, it's very difficult to get their arms to the wall. So you just have them do as much as they can, and that's done 20 times. Lesson number 3, if they're still wearing spots, morning, afternoon, bedtime. And I want you to really maintain that so that they don't forget that, because it seems that if they drop off here at all, they kind of tend to stop wearing those spots, and they're exceedingly important for us to wrap this up in the number of sessions that we talked about. So first exercise on lesson number 3 is called tooth cleaners. They look like this. The person is sweeping the inside of the lips and around all of the gum tissue, 10 in one direction, 10 in another. You began the button pull last time. This time, I've added a button to a bottle with some weight in it, actually. And you don't always have to have a bottle quite this size, but it's great if you can, because the objective here is to begin to do more and more weight. So what you're going to have your patient do is stand up, put the button in their lips, bend over at a 90-degree angle. The second exercise on lesson number 3 is penny stick hold again, where I've added some additional weight. And you want to continue to do this. This exercise goes on for 4 or 5 more sessions, and you want them to continue to add weight to build the lateral border and the tongue tip muscles. So that added strength helps to keep that tongue resting in the palate. Turtle lips, which is an exercise designed to stretch the buccinator muscles, the levator muscles, and actually all of the anterior facial muscles, and stretch the upper lip. Looks like this. You can see that it also works the hyoid muscles and many of the lateral muscles in the face. What I see from this is that the upper lip typically gets another millimeter or 2 within a week's time if the patients do them very well. So they hold that one 20 counts. The last one here is straw drinking for the lips. We're doing this again where I filled a cup that I might put a mark on, and I might use a larger cup and a longer straw, but this is quite simple to do. You time your patient drinking with the back teeth together and a nice pucker of the lips. So back teeth are closed, tongue tip is up, puckering and swallowing. Good to the last drop. Posture exercise for lesson number 3 is corner wall stretch. Corner wall stand is designed to expand the pec muscles and the rib cage and to rotate the shoulders back. So hands are on the wall, each wall at about head height, feet are together, and the person just stretches through. It's amazing how this works the core. I see patients coming back where the parents are saying that they can't believe how much just these first 3 sessions has made such a difference in body posture. Lesson number 4 begins with tongue exercises again, the first being suction, hold, stretch. You're going to begin with your tongue tip touching the spot. The rest of the tongue suction into the palate as if you're going to pop. Maintaining that position, you open your mouth wide. And you hold that one 20 counts. Sometimes that's a difficult one for patients to accomplish because they just don't seem to be able to get the suction started. So if you have them begin to pop, they at least get the sense of that suction and they can hold it and stretch. Right, we're continuing on with the penny stick because we're going for strength in that tongue to be able to hold it up. I know there's controversy about muscle toning, muscle building, but if you don't have tongue strength to lift and hold that tongue into the palate, you are not going to get your therapy accomplished as you had designed because you need that tongue strength to be held so that the muscles are actually holding the tongue into the palate. So I've added some more coins. And you can see that it's getting a little heavier, even for me. So you want patients to really spend the energy putting more coins on, but not many at a time, so that they're incrementally working up on those. And that one, they're holding 20 counts. We're still working with the bottle, adding more weight so that we're working to increase the upper lip length. That philtrum length is probably still shorter than we'd like. It also increases the tonicity of all of the lateral facial muscles and works on the anterior neck muscles and the hyoids as well. It's great for body posture as well if you can make sure that your patient is at a 90-degree angle. So make certain that that button is spending more time in the upper lip, not in the lower lip, sort of dragging down. And you need to encourage your patients to take it easy on adding weight to the bottle because so often they get over-enthusiastic and add too much and then the bottle's dropping out continuously and the exercise ceases to be any fun and certainly not of any value. Cork pops, cork pulls, these are. You're going to put the cork through your teeth, through your lips, sucking your cheeks in as if you were doing the turtle surprise phase as on the last lesson, and have them pull and then pop. You can see which muscles that's working on. It also stretches the philtrum and really works on strength here in the masseters and also in the buccinator muscles. Straw drinking is continuing on this because drinking or swallowing with back teeth closed is ultimately important for this therapy, so that when the person is actually swallowing, we want some sort of tooth occlusion So back teeth are together, tongue tip is up, there's a pucker. So it should be happening faster. As you saw with that swallow, it should be much easier. The posture exercise for this lesson is corner push-ups. Feet are together, hands are slightly further apart, and they're going to do push-ups just like this. Again, designed probably more for awareness of shoulders to be back and elevated, getting the sternum up so that they're actually standing straighter. But I see patients coming back after this session where parents are saying, oh my goodness, their posture has improved greatly. And as they do, tongue is up, and maybe it is the tongue is up, which enhances the increased body posture. So either way, at least making them aware is smart. I still ask the patients to use spots 3 times a day. However, by now the kids may be into a lot of sports or that sort of thing and doing things after school, so it makes it difficult for them to actually get an after-school spot in. But most adults are pretty compliant with this. But you're still looking at making certain the tongue is resting where it should be, so that by now it should be spending most of its time like this. Thank heaven for these sticky tongues. Tip sit-ups look like this, which we're working now on just tongue control and the ability for the tongue to move with purpose. Many people will still have trouble doing that. Notice that it needs to be horizontal. So you start with the tongue horizontal, elevate, and come back to the beginning point. We're continuing on the suction. This time, you're going to suction, hold, close, and open for some final stretch actually on the lingual frenulum. So closing always onto the molars if possible. You'll find some people going, I want it more of a smile and a really good stretch. As long as you don't have serious TM joint issues, this should not be a problem. And if you do have serious TMJ problems with your patients, what I want you to do is just take it easy. Don't have them open as far. All right. Lip exercises here are continuing with the bottle hold, hopefully having gotten quite a lot more weight in the bottle so that you're seeing as your patient is doing his 90-degree bend over there. You can honestly look at the face muscles and look at the upper lip to see that you're getting a nice stretch. This is one way that I think we're able to get to our ultimate goal of lip length as we move through this. Turtle surprise pops look like this. So they're assuming the same turtle surprise appearance, remembering to raise the eyebrows so that you get a fully anterior facial stretch, and try to get as loud a pop as possible. Bilateral chewing is done by using two small crackers, one on the left, one on the right, so that you are teaching vertical chewing. I know a lot of people talk about rotary chewing. I don't see a lot of people rotary chew. I would rather they were doing vertical chewing so that they're actually using those teeth to masticate the food well. So it should be easy as they're doing this if their molars are actually occluding at all. Teeth don't honestly touch during chewing typically. They do when the person swallows. Now for a swallow, and the food should go right down. The last exercise is a posture exercise again, and it's done in a doorway, preferably the bathroom doorway, because it's usually the smallest or most narrow in the house. If the hands are on either side of the doorway, the person can grab the door and drop right through. I tell the kids to pretend they're on the Titanic and they're stretching all of these muscles with head up, tongue up, breathing through their nose, not through the mouth. And that's something you need to watch on all of these posture exercises. So often people will do the wall stand or the wall slide like this. So you want to be certain that the tongue is up, the lips are closed, their nasal breathing. On the doorway fly through, they're holding either side of the door, stretching through, and are really stretching all of these muscles with tongue up, lips closed, head position in a very straight fashion like this. Lesson number 6, we're still doing spots. The tongue is still learning. For most of your patients, think how long it's been that tongue has been down or misplaced. So know that it still needs some energy for thinking about where the tongue should be at rest and for swallowing. So I'm pretty adamant about continuing on with the spots. By the way, I give the patients everything from day number 1. I never ask them to go and get anything. I never ask them to go and buy things, because if I don't have it, they don't need it. So I think it's really important that we're able to supply them. These things that we use are not that expensive and they're available. And if the kids are bringing their bags back so that they're getting things filled, filling up their charts as they're supposed to, then it's relatively easy to keep them motivated to doing the exercises. So on this session, the first time that we're doing fat skinnies means that they look like this. Fat and skinny really narrows that tongue. Let's say you still have a tongue that has scalloped edges or bright red ridges all the way around the lateral borders of the tongue. This will help to develop that tongue lift posture and strengthen the muscles from the sides. That's the only actual exercise we're doing, unless you feel like you need to continue on with the penny stick. If you feel like the borders of the tongue have not strengthened enough, you might continue on with that penny stick hold or the coin stick hold, so that they're continuing to build the musculature that actually supports the sides of the tongue being up into the palate. We're continuing on the bottle hold as we get near the end of therapy. They should be able to hold quite a large amount of weight. I have several patients who can hold 3 and 4 pounds of weight. So as much as you can press those patients to really move with a lot of weight there, you're really building tone here. And this is where I see open bites close, overjets reduce quite a bit. And certainly once the overjet reduces, we'll see quite a lot of expansion in the palatal arch, provided the tongue is resting up. We're probably not quite at where we'd like to be typically in this exercise series with the upper lip length and maybe even the lower lip length, depending on how well patients have done. So one exercise that's both kind of fun and funny, but also very effective, is called Great Granny Screamers. They look like this. You notice that I was holding each about 3 counts. I was not moving my jaw. All that was moving are the lower facial muscles and a good stretch on the upper lip. Another one to just make certain that we're getting to the goal for the upper lip in particular is called air trap. If you close back teeth, close lips, and puff air just into the upper lip, it looks like this. If you've seen the movie The Grinch Who Stole Christmas, those we call Who lips. The Who's from Whoville look somewhat like that. So the stretch and hold will really tighten these muscles as well, but also elongate that philtrum. In order to just assess that the swallowing is happening correctly by now, it's very simple to do a squirt and a swallow. Probably best to do these with cheek retractors in, where you do a squirt to the back of the tongue, have the patient elevate the tongue tip to the spot, and bite, smile, and swallow. Like that. That squirted water should just go down in one easy swallow. And you should see your patient kind of gather the water onto the back of the tongue, especially if the squirt pistol or the squirt bottle shoots straight. And not like that. We're working on bilateral chewing, making certain that people are chewing with lips together and teeth occluding as much as possible. Getting ready for a swallow. Food is in a bolus on the tongue. A bite, a smile, and a swallow. And the food should be gone. Often I'll send a placemat home with people if they're still having a difficult time chewing and swallowing with their lips closed during mealtime at home. It's a small mat that just sits under their plate that reminds them to take small bites, chew with their lips closed, and swallow with their back teeth together. The posture exercise for this lesson is fingers laced, arms behind you stretched, fingers touching the waist, and a good stretch with the head just tilted back, stretching the arms back, a little bit of a bend in the back, holding it like this, 20 counts. Again, it's the continual emphasis of getting the shoulders back so that the head is level, the tongue is up, and their nasal breathing. On lesson number 7, we're still doing spots at least twice a day at this point, certainly at night, definitely. Just again, working hard to get that tongue to maintain its posture into the palate. Then, fat skinny, fat taco is just another method of making certain that that tongue is working both laterally and vertically. So, suction, hold, open, close, bite, smile, swallow is the next exercise. But since you only swallow on average twice a minute, it's a little difficult to do this and have several swallows in succession. So you want to have your patient try this throughout the day. And then take a little bit of a rest and try it again, so that they are really setting into their brain how that swallow happens. Tongue is up, teeth are together, the swallow happens from here, not from there. We're still doing the bottle hold because at this point we're going for the maximum amount of strength and length in the upper lip. So if you will continue adding weight to the bottle, I buy little gems that I have the patients put gems into the bottle that are quite bright and shiny. That makes it kind of fun. And at this point in time, they should have at least 2 pounds of weight in a bottle, being able to hold it with the button that you have attached to the bottle. We're still working sometimes on getting the upper lip longer. So I've purchased some pacifiers, which I've cut the dummy end of it off, and a nice stretch is allowable by inserting what I refer to as the liposizer into the lips so that you can stretch and pull. You can actually maneuver it quite a bit in the upper lip for a nice stretch. It's easier to do than putting thumbs and fingers in the mouth for some people. It looks like this. Now, for some people where this is a little bit difficult because it's high, you can flip that over. Do it the other direction. You can see the number of muscles that actually work with that. Now we're doing a little bit of finalizing of upper lip length. You take a 1.5 inch cotton roll, dental cotton roll, which has been moistened and flattened slightly, and tuck it up inside the vestibule above the upper teeth, so that you are asking your patient to hold that for at least half an hour while they're doing homework, watching a movie, studying, reading, that sort of thing. So you take that and tuck it into the upper lip if you just need additional stretch. So you see, people could still talk on their cell phones and do anything they need to do, but they need to have that nice final stretch going. So it's half an hour at least, and I have some patients who sleep with them overnight. I don't require that, but if we're going for final lip length of the philtrum here, then sometimes they'll give it an extra push. The last chewing exercise is done again by chewing bilaterally, gathering the food after it's been chewed into a bolus on the back of the tongue and checking it. Some parents might find this difficult to watch, but kids sort of enjoy it usually. But you want to be certain that you're creating a bolus of food in the center of the tongue that you can actually feel and be aware that is swallowed in one swallow. Sometimes you'll have a few crumbs left from a cracker, but for the most part, that bolus is being absolutely swallowed in one swallow. There's a posture exercise session on this last group of exercises here, but I typically allow the patient to choose what they feel they A, need to do, or B, like to do most of all for posture. Often the ones that are chosen are the wall slides, the wall stand, or maybe the doorway fly-through. Most kids really enjoy that one. So we're looking at keeping head, neck, and body posture up. On lesson number 8, I give the patient a lot of choices. As you can see, there are 2 for each: tongue, lips, maybe even jaw at this point. And I let them choose what they feel like A, they might need to do, or B, they would like to do, especially if we're not quite where we need to be, or if we're feeling just like there should be some maintenance or making sure that we're getting to the point by the end of the sessions. Not every patient is finished by lesson number 8. So if you haven't accomplished your lip length, quite accomplished your lip length, or you have not accomplished your strength in lip strength, or certainly if you feel like posture needs to be worked on, then you can still continue to work on that for a couple more sessions. So lesson number 8, the typical choices that would be made for tongue exercises would be tip pops and palate scrapes. Because they're easy, they're not too obtrusive to do in public. The tip pops might be. But then typically if you allow the patient to choose what they're going to be doing, they'll do it. Now, for the lips, usually people will choose lip pops, granny surprise face, or turtle surprise face. The lip exercises that most people might choose would be lip pops, granny surprise face, and granny screamers. Those are 3 really dynamic exercises for finishing off the upper lip and lower lip lengths that you might need after 8 weeks. For swallowing exercises, I might ask them to use a mirror at their dinner table, something small like this, where it just focuses on their lips and they can watch themselves as they eat. However, some parents choose to get larger mirrors so that they can actually see themselves a little further away from the table. And if you ask a sibling to watch and see if they're eating properly, very often the siblings are quite pleased to tell you whether it's going well or not when they return on the next session. I have the patients pick posture exercises that they feel are beneficial for them or ones that they like. The typical ones chosen are doorway fly through and the corner wall stand, because most people feel that one quite a bit. In certainly head posture, the stretch across the pecs, the upper pec muscles here, and tightening the scapula. It's amazing how you will see a big change if you can keep these people working just once a day on a posture exercise. Now at this point, if you are still having some issues with lip strength, lip length, open mouth posture, hopefully not by now, because hopefully you've dealt with that much earlier with an ENT, with the allergist, certainly with the parents doing what they need to do relative to having some sort of checkups done for tonsils, adenoids, and turbinates, then the only issues that I usually see would be body posture, perhaps, in some of the teenagers, and maybe some speech issues for some of the younger kids if they haven't self-corrected by now. Every patient seems to need some sort of chart. Some adults will reject having something like this, but I've designed this so that it is actually a weekly chart, and it's done in morning, afternoon, and night time, so that it's the times that they put spots in, so that I give them stickers as well, so that they can actually place the stickers onto the chart as they practice. And of course some kids come and they're doing the stickers on their way in. But one thing that you will know by the measurements that you're taking is whether they've practiced or not. Because if you're not getting changes in the measurements of the upper lip, the lower lip, the overjet, and the width, you can assume that your patient is not practicing the exercises. After doing this for this many years, I know that they work. And if you can motivate your patients to do them the way they are designed, you're going to get the end result that you are after.